Hi, this is Hannah, and this is my mini study analysis table. The research problem: effective dietary and supplement protocols for the management of gestational diabetes. Looking at specific supplements and the specific dosage that research has shown helps control blood sugars, also looking at what specific diet types are most beneficial in managing gestational diabetes. My personal interest: I have recently been learning a lot about the importance of regulating blood sugar for overall health. Clinical interest: while it is agreed on that diet, exercise, and supplements play a key role in the management of GDM, I do not often see specific defined protocols for what that looks like. I would like to give clients evidence-based lifelong tools to help them control blood sugar. Gestational diabetes is also on the rise, so that would be another clinical interest. The first study we're going to look at is going to evaluate the effects of myo-inositol supplementation on glycemic control and maternal fetal outcomes in women with GDM. So there was 330 women with GDM, 18 years age or older. The study was done in Italy from January 2018 to December 2022. It was a cohort study. The intervention group did 4,000 milligrams of myo-inositol per day in comparison to the control group who did not supplement with myo-inositol. The intervention started at the diagnosis of GDM and was done until delivery. The results: clients in intervention group had significantly lower fasting plasma glucose, postprandial dinner glucose, insulin requirement both in second and third trimesters than those in the control group, lower birth weight, and lower incidence of neonatal hypoglycemia in intervention group. So weaknesses would include that this was not a randomized design. Myo-inositol dose is higher than other studies conducted on women with GDM. However, it is the same dose used in studies conducted in the treatment of PCOS, and potential co-founders of selection and recall biases. Strengths would be: it's a large sample size of clients, evaluation of insulin requirements, and self-monitoring blood glucose daily. The second study that we're going to look at is comparing women with GDM who supplemented with magnesium, zinc, calcium, vitamin D, co-supplementation, or were given placebo, and evaluating the effects on reducing biomarkers of inflammation and oxidative stress. So there were 60 women in this study, age 18 to 40. The study was done in Iran between March and November of 2017. This was a randomized, double-blind, placebo-controlled trial. The intervention group did 100 milligrams of magnesium, 4 milligrams of zinc, 400 milligrams of calcium, and 200 IUs of vitamin D twice per day, in comparison to the control group that did the placebo twice per day. This intervention lasted for 6 weeks during the pregnancy. So the results were: co-supplementation of magnesium, zinc, calcium, vitamin D may reduce biomarkers of inflammation and oxidative stress. There was also a decreased rate of macrosomia in the intervention group. So the weaknesses would include that this was a very small sample size. A 6-week intervention may not be long enough to determine changes. And strengths were that it was a randomized, double-blind, placebo-controlled trial. There was a high compliance rate, greater than 90%, and self-monitoring blood glucose daily plus weekly check-ins. And then going on to our third study. This one is evaluating the effects of myo-inositol supplementation on glucose variability in women with GDM. So this study had 12 Caucasian women with GDM. The average age was 34, and 25% of them were insulin treated. And this study was done in Italy from January 2014 to July of 2014. So this was a pilot case control study. Intervention group did myo-inositol 2 grams plus 200 milligram folic acid twice per day, in comparison to the control group that did 200 milligrams of folic acid twice per day. The intervention went from 30 weeks gestation until delivery. And the results were myo-inositol supplementation is effective in lowering blood glucose levels and blood glucose variability in women with GDM. So weaknesses include that this was a very, very small sample size. Case control design, so it does not allow to test for cause effect, and lack of information on blood glucose variability indexes and pregnancy outcomes. Strengths would be continuous blood glucose monitoring, automatically records 288 glucose values per day, and is capable to give several parameters such as glucose means, specific glucose trends, and glucose variability indexes. So those are my 3 studies. Thank you.